Your doctor says it's just menopause when you mention the racing thoughts, chest tightness, and panic attacks, the excruciating anxiety at 3 a.m., and the constant exhaustion because your mind never stops. What if a supplement could calm your nervous system without needing to be on a benzodiazepine? Hi, I'm Dr. I'm an integrative psychiatrist and lifestyle medicine physician. When it comes to menopausal anxiety, it's not just in your head. When estrogen drops, it takes your brain's natural calm down chemicals with it. Your GABA system, think of it as your brain's brake pedal, stops working properly. Now, there's a supplement called inositol that's been helping women for decades, and the research is actually pretty remarkable. Let me tell you about Alexis, one of my patients. 52 years old, successful attorney, started having panic attacks during their positions, something that had never happened in her 20-year career. Her doctor prescribed Lexapro, but she wanted to try something else first. That's when she tried inositol. Now, before you think this is just another supplement trend, let me share what the science actually shows. Some research found inositol to be as effective as certain medications like fluvoxamine and SSRI for reducing panic attack frequency with fewer side effects. But here's the part that really caught my attention, and I'll explain why this matters so much for menopausal women in just a moment. Inositol works differently than traditional anxiety medications. Regular anxiety pills boost the amount of feel-good chemicals in your brain. Inositol works by enhancing the communication between brain cells. It's more like fixing the wiring, not just turning up the volume. The typical dose that showed benefits in research was 12 grams daily. That might sound like a lot, but inositol is very well tolerated. Unlike many anxiety medications, it doesn't cause weight gain, sexual side effects, or foggy feelings. And here's something fascinating. Inositol doesn't just help with anxiety. Studies show it can improve sleep quality, reduce irritability, and even help with those emotional roller coasters. But, and this is crucial, not all inositol is created equal. The research primarily utilized myo-inositol, the most common form. Some studies combined it with D-inositol in a specific ratio. This matters because taking the wrong form or dose may not yield the desired results. If you're considering inositol, it is recommended to start with a low dose. Most research on mental health conditions uses higher doses, typically 12 to 18 grams per day, split in 2 or 3 doses. It is, however, advisable to start at a lower dose of 2 to 4 grams twice daily to minimize side effects such as bloating or gas. Clinical studies show it may take 4 to 6 weeks to notice benefits. Your brain needs time to adjust and rebuild healthy pathways. Some evidence and clinical experience suggests that combining magnesium glycinate with inositol may enhance relaxation and support sleep. Always talk to your healthcare provider before starting new supplements, especially if you take medications or have other health conditions. Speaking of getting the right support during menopause, I've created a free practical guide that helps menopausal anxiety. You can download it using the link in the description below. So let's talk about what to expect. Some women notice improvements within a couple of weeks. Others need several weeks. Alexis, the attorney I mentioned, she started sleeping better after 2 weeks. Her panic attacks improved after 3 weeks. A few months later, she's handling depositions like the confident lawyer she's always been. Here's what's exciting. Unlike prescription anxiety medications, you don't have to worry about dependency or withdrawal with inositol. Your body makes this compound naturally. We're just giving it extra support during a time when everything feels chaotic. The main form, myo-inositol, is synthesized naturally in the human body, primarily in the kidneys and liver. One important note, if you're taking lithium, talk to your doctor first. Inositol can affect lithium levels, and if you're on other psychiatric medications, it's always smart to discuss any new supplements with your prescriber. If you're more interested in natural treatments, then this next video will interest you. I talk about the top 5 supplements for women in peri and post-menopause.